All right, so I'm trying something new this time around. We got access to the live stream for the county executive's YouTube station.
Oh.
We're also on that. So I'm hoping it all works out today.
You shouldn't have told us that. I didn't need the extra pressure. I would have put gel in my hair then.
Oh, you look good.
Oh, thanks. I would have added gel at least, not conditioner. Oh.
Hello.
So we'll get some folks there.
Hello.
You look good, Dr. Shaw, don't worry.
Look good.
Thanks. I was just trying to fix the angles of the bed there.
Yeah. Hi, Dr. Tazano.
Hi, Karen. How are you? How's everyone?
Good, good.
I'm thinking I may have to join on my phone and computer, maybe mute computer, because sometimes the quality. If you can hear me okay, I don't know.
We can hear you. See you fine. Yep.
I can hear you.
Yeah,
You can? Oh, okay.
It's really good.
All right.
Yep.
Perfect. I have one more thing to add to this slide. I thought about it this morning, so I'm going to do that now.
Certainly. Right. Admitting people. Admit. Admit. Okay.
Oh, I have an awful shadow. Let me see if I can move.
Hi.
Is this a meeting for people who are just regular people and not therapists or?
Yes, ma'am. You're fine.
Okay.
Yep. We're talking about supports to parents regarding behavioral health amidst COVID-19 and back to school. Our folks are slowly coming on in. Hi.
Hello, how are you?
Good. How are you?
I'm well.
Good, good. So letting folks in bit by bit.
Carrie Ann, I so apologize, but I may have a tight, I need to get off at 3 o'clock.
Okay, no problem. Yep.
Apologies, yes.
No. It's fine. That's fine.
And we should have our slides ready to screen share as needed, right?
Yes.
Okay.
Yep. And I'll be turning that over to you guys. Also, folks, it looks like we got the opportunity to also be broadcasting on the county executive's YouTube platform. So people may join on that as well as we're on this. So
Okay.
make sure that we're as accessible as possible. All right, 2 o'clock. Get started shortly. There's Dr. Askew. All right. Well, because I know how this is another t-shirt slogan, you know, I'm stretched for time. The other slogan for 2020, apart from I'm on mute. So make sure for the consideration of everybody's time. Thank you for all those who have joined us. Thank you to our panelists who are all here as well. Dr. Askew, the Deputy Chief Administrative Officer for Health, Human Services, and Education is with us, sitting in for the County Executive, who unfortunately could not make it to be with us this afternoon. My name is Carrie Ann Peart. Well, newly minted Dr. Carrie Ann Peart. I'm getting used to that. So I sit as the Senior Advisor for the Health, Human Services, and Education portfolio for the County Executive. And as such, I've been involved with a number of our advocates as well as our professionals at the Health Department for our county in hosting several webinars over the course of this year, really touching on behavioral health resources and supports for our residents. And so this is what we have now dubbed our fall seminar series. And we will be touching on issues related to specifically supporting students, parents, and guardians during this time amidst COVID and the anxiety of going back to school. So that will be the focus of today's conversation, as well as the panel next week. But our panelists this week are representatives from various organizations that I will present to you after we get some words of welcome from Dr. Askew. Dr. Askew, turning over to you.
All right, making sure that I am unmuted. Good afternoon, everyone. It is afternoon. I sometimes lose track of the hours, particularly now. I'm not going to take a lot of time because I know there's a lot to be covered, and we have such a great group of folks here to speak. But I wanted to welcome you all on behalf of the county executive. She and I share the concern that the impacts of the COVID pandemic on the broader health and well-being are potentially deep, and particularly the mental health of children and families. I'm so glad you've chosen to participate in this session. I want to thank the esteemed group of panelists and Dr. Peart for pulling this all together. I think you will find this extraordinarily helpful and interesting. I know the county executive would want to thank you individually, Dr. Shaw. Oops, I think I just lost my connection.
We can still hear you and see you.
Yeah, we can still hear you.
Oh, you can still hear and see me? Oh, good.
Yes.
Because my screen just like completely blew up. I won't go through the new, but again, wanted to thank you and recognizing that, you know, as I said, our children are experiencing a period of tremendous change, and particularly around schooling. You know, it's an unusual start for all of us, especially during a year where strange has become, in a sense, the new normal. At the county level, we're doing everything we can to support parents, and whether it's managing behavioral stressors at home or directing the county's parents to resources they need to provide a stellar education for their kids during this pandemic. In the county public schools, as you know, Dr. Goldson is doing everything possible to look after schools and our students. She's worked tirelessly to protect our children, parents, and teachers and staff from COVID-19, while at the same time making sure no one falls behind on their education. She's implemented distance learning for the first 2 quarters of this school year with the support of our health department, of course, families, employees, community members, and the county executive also played, of course, an important role in all of that. Again, I don't want to spend too much time because again, there's a lot to be covered, and know that Prince George's County, while you know, we remain a tight-knit community that comes together to take on challenges, and this pandemic is just another challenge that will show us to be Prince George proud, Prince George is strong. And again, I turn it back to Dr. Peart to lead us through the afternoon.
Thank you. And what I'm going to do now, which I should have done earlier, but It's just to let everybody know that we're also live on the County Executive's YouTube page as well. So I'll be recording from here on out, moving forward. And again, where we go. And again, just thanking everybody who's attending. So our panelists consist of Dr. Taznu, who is the Executive Director, Pediatrician, and mother of autistic children. But she's an Executive Director of the One World Center for Autism here in the county. Dr. Simpson, who is an emergency medicine practitioner for Children's Hospital in DC. Dr. Crawford, who is our CEO and Clinical Director at Maryland Family Resource. And Dr. Park, who is the Director of Greenbelt Cares. And finally, Dr. Shaw, who is our Medical Director for Behavioral Health in our department, in our county health department, Department of County Health. So welcome again, everybody. And again, the focus of today's conversation will be parent support, student supports as it relates to back to school. Each one of our panelists has a mini presentation to give, after which we will open up to questions and answers. And if no one has a striking question, I will start us off and get us going with dialogue. So first up for presentation is Dr. Taznu, and I'd like to give you the ability to go ahead and share your screen, Dr. Taznu. You're on mute still.
Good afternoon, everyone. Thank you so much for the opportunity to be able to share and specifically share this perspective of children and families that are living with developmental differences. A kind of small presentation by saying that I in no means can encompass every family or every child's struggle. And I just hope to be able to kind of present some global challenges that we are all facing during this time. But everyone's, challenges are unique. So I'm going to attempt to share my screen just to give you an overview and then just talk about just some simple, what I feel are simple resources we can begin to kind of embrace. And these resources are not just good for those of us who are living with special needs. I think it could be adopted by anyone. So let me see if I can get my screen. Okay, is that visible?
Yes, we can see it.
I feel like I'm not. Can you see the screen?
Yep, you're good.
Okay, perfect. I feel like there's some glitching. I'm not hearing everyone. So as Dr. Pittman said, I represent the for pediatrics as a part, I feel like I wear many. The most important is that of being a mom, and a mom to 5 children, all with very unique needs. 3 who have autism and comorbid emotional behavioral health concerns. And so our organization was really founded in order to support families living with autism. And our goal is to really do that in a comprehensive manner. Let me see if I can advance my slide here. Sorry, let's see. I may have to go to a different screen share. Let's see. I feel this. Let's see. Just be patient with me. I'm not getting to advance the slides the way I'd like to. Let's try again. Okay, let's try this view. Okay, is that visible? That particular view?
Yes.
Okay. So I'm going to move to our next slide. Basically, just giving you an overview in terms of what we hope to do as a organization and how we support families in Prince George's County and neighboring communities. We do that through 3 arms of services: individual support, family support, as well as community outreach. And our vision really is to create a world where families living with autism are genuinely accepted and they're able to realize their greatest sense of well-being. And well-being is huge, and that's why we're all here today. I want to first kind of just give a bit of an overview of kind of life pre-COVID for those of us that are living with developmental differences and comorbid emotional behavioral health concerns, and then what COVID has done. So I found this little graphic that I thought kind of shares that. For many of us in our world, stress is kind of a common thing. It's nothing new for us. And there are many studies that have equated the stress levels of parents and caregivers of children with special needs as that equal to those in soldiers in full combat. So you can see that we've already are entering COVID with a lot of, it is now this fuel that has kind of magnified all the fires, blurred our responsibility. So level of overwhelming, but to our struggles that I feel have prior to COVID and stigma. And for those of us who may not be raising children with special needs, that's something that's new. COVID has brought that to all of us. But for those of us with children with special needs, that's kind of been our norm. In addition to that, lack of caregiver emotional support. So, we have families in different stages, grief, acceptance, trying to figure out, what is happening with their child and trying to come with the, wrestle with the emotional. A lack of natural family support. Supports will fall away as you begin to embrace more of what your child or your children may be diagnosed with and how you're supporting that. Oftentimes, family fragmentation common in our community. Many of the single parenting. Bit of if anyone's not familiar, care for the well-being. We are already challenged with that. In general, I think is also even more diverse county cultures, but a lot of differences in how schools as special needs, and then limited employment. That can come under, we have families that do good jobs, but because it's very flexible, full-time job, or they may to their children. In addition to that, about children developmental or special needs. I think what we tend is access, whether care and or emotional behavioral, and what we do.
Sorry, Dr. Tasanu,
Yes.
you're coming in and out a bit.
Can you hear me?
If it's bandwidth on your end, maybe call in on your phone simultaneously.
No.
I'm not sure.
Can you hear me?
We can hear you, but you're coming in and out, so some things are breaking up.
Would you like me to join by phone or?
Try that and see. You can stay on video, so you'd mute yourself here and then call in because we want to hear what you're saying. Smoothly. Yeah.
Where did you last hear?
I was following you on the slide. So the slide previous to this one.
Okay.
Let me, was it just me or were others also kind of hearing her spotty?
No,
It was spotty.
Okay.
Find the invitation and join that way.
All right.
Well, I'm fine. I'm present. I don't know if that worked.
Can you can message me in the chat box?
Okay.
You're breaking up again. And while we sort through Dr. Tazzo, and let me figure out how to help. Okay. Okay.
You might have already done this, but if you close all your other windows, or if you have the option to come off of VPN, if you are on VPN, that often helps.
Yeah, I think it has to do with just wiring. I often at this time start to experience some of that. So, but I will take that bit of advice. But Karen, why don't you, if you want to go ahead with another panelist, and then I can try and figure this out, sort it out.
All righty. We'll do that. Okay. Dr. Simpson, could we have you go ahead and
Sure, I'd be happy to. I'll
thank
share
you.
my screen. I
Dr.
think you need
Pierce?
to
Hold on.
I'm so sorry. I was just going to ask you if you could put in the chat the call-in information. So in case
Yes,
you
I'm
have
going to
trouble.
do that. Just 1 second.
Okay, thank you.
Thank you.
Sorry, Dr. Simpson.
No worries. It's telling me it's not enabled. Oh, there we
Yep.
go.
You guys going to get it there.
Should be able to. All right, let's do this. Okay, you can see my screen?
Yes, ma'am.
Excellent. Thank you for having me today. So to introduce myself, my name is Joelle Simpson. I am a pediatrician and emergency medicine physician at Children's National. I hold 2 titles at Children's. One is as interim chief of the emergency department. So I lead our team of well over 300 staff members, physicians, nurses, and many, many others who help with running our lovely emergency department here on Michigan Avenue in DC, but also at United Medical Center in Southeast DC. And then we also work at Doctors Hospital in the pediatric emergency department there in Lanham, Maryland. Recently, oh, and my second title that I hold at Children's National is as Medical Director for Emergency Preparedness. So what that means is I have been very much intertwined in the quote unquote COVID experience for Children's National and inherently for the region as we are such a large pediatric presence in this area. So I've been working with the local county governments, including Prince George's and DC, and to some extent, Northern Virginia and other parts of Maryland. And very much have had a hands-on experience working both in the emergency department and then personally with friends and family members with kids who have been significantly affected by the COVID pandemic. And while I know that the numbers have not been showing, fortunately, for kids to be significantly clinically impacted from the sense of respiratory illness that we've been seeing in adults, we do know that the topic we're talking about today, behavioral health, mental health, and so forth, with a lot of the impact of the public health measures for COVID-19 have seriously impacted our kids. The other angle I come from is from the perspective of having I was one of the team of folks that led the COVID-19 testing site that was a drive-through site here in Washington, DC. Almost 50% of the patients that came through our testing site were from Prince George's County when we looked at their zip codes. And so I know that we at Children's National do serve a large part of the Prince George's pediatric population from both an emergency department perspective, but then also through the COVID testing lens from earlier on in the pandemic. That being said, we were very excited that despite all the other things that were put on pause in our life because of COVID, that we were able to open up the Prince George's County as shown on the picture here. So, and that's in Lanham, Maryland. And this is a picture of our beautiful building that we just opened up earlier on this summer. In terms of the topic today and the mental health resources that we provide at that building, you know, there are multiple outpatient resources that we provide for the community. In particular, the neurodevelopmental conditions that we treat include the list below. And to that end, if you were to go onto our website and were to look up the Prince George's County site, I would advise you to take a look through our video. We have a video portrayal of what the rooms look like there and what the space looks like, which I think actually does play a large role into the comfort of patients and our families who truly want to optimize the patient experience, especially in the context of all the other limitations we have for patient care now because of COVID, that we're trying to optimize our layout and even our square footage there to be a comfortable environment that's amenable to managing the conditions as listed here. Our evaluations and treatment that we can perform there include everything from ADHD to sickle cell disease and the complications there, epilepsy, concussions, the autism spectrum disorders, and so forth. And we do have some specialized programs for specific neurodevelopmental disorders that occur with other, not just our developmental pediatricians, but need the assistance of other team members in our team at Children's National. So that would include our hearing and speech services, our rehab medicine services, neurogenetics, neuropsychology, and as I mentioned before, here's a look at our team members who are going to be placed or serving mostly at the Prince George's County site. Dr. Grutman is the Division Chief for Neurodevelopmental Pediatrics and Neurogenetics, and Dr. Gersh is our neurodevelopmental specialist who will be managing or leading most of the services that we have for those areas at our Prince George's County site. And then we also have our neuropsychologists who are on board there, Dr. Bollock and Dr. Newman. So I wanted to put a face to the names that you would be interfacing with at our site there. In addition, and I'm sorry, for some reason my screen keeps getting muted. We also have taken over the previous Tacoma Theater building, and that's located, while it's in DC, very close to our Maryland border. So I wanted to bring this up as another service that we're providing that also has services for neuropsychology, our pediatric development program, psychiatry, and behavioral health, as well as a service for childhood language disorder. One of the things that I want to highlight today, in addition to the fact that we have now these outpatient services over in both the Prince George's County site as well as the Tacoma Theater site, is the fact that we know that the needs of our families occur on a spectrum. So we are hoping that we're able to continue to help you with helping to work with your kids in the community that you live in. So in Prince George's County. And so we are recently at Children's National have been hosting a weekly webinar or every other week webinar that has been focusing mostly on sort of parenting tools and tips, not just for you, but for our teachers and for our pediatricians in order to help guide what our community services and on how we interact with our kids on a day-to-day basis as we go through the challenges of COVID-19. That being said, besides the education that we provide on our Return to School website, and I'd recommend that you go to our childrensnational.org/return to school to see the wide array of services there, or the recorded webinars there, as well as pamphlets and information. But it's also to check out our sites as listed before, for our rooms and our spaces that will be opened up for you to have outpatient services for your kids. But also, from my role as I sit in the emergency department of Children's National, to know that we're also a resource for you in that acute need, that emergency need. We have been very much paying attention to some of the restrictions that have occurred in COVID-19 for things as simple as having a one parent or one guardian limit to accompanying a child or a patient at our facility. That's something that has been uniform across all hospitals, if not at least children's hospitals, but we know that that's a limitation, and that can be a barrier for you when you're dealing with a child who may be having an outburst or be having an acute challenge that requires more than one person there with them. We want to work with you in the emergency setting, and we have been talking through our patient experience perspectives, particularly as it pertains to mental health resources, and have been trying to adapt the way that we provide our services in this COVID-19 climate to be able to respond to your needs when they are acute, but at the same time hoping that we're able to continue to do preventive and ongoing care in our communities so that we don't have to necessarily get to that point of the emergency care perspective. So that is sort of the summary of what we have at Children's National. I'm happy to, after the other speakers have been able to share their resources, to take any questions about our services.
Thank you, Dr. Simpson. All right, Dr. Tasnu, would you like to wrap up your presentation? You're on mute on your phone. I think you called in.
Okay.
There's an echo. All righty, we have to figure out the tech difficulties with Dr. Tasnu today. Dr. Crawford, would you like to go ahead and have you do your roll through? You're still on mute, Dr. Crawford.
Okay, here we go. Good afternoon. I'm Dr. Beth Crawford. I'm a licensed clinical psychologist, and I'm the CEO at Maryland Family Resource in Landover, Maryland. Thank you all for joining us, and I hope the information I'll be sharing today will be useful. The topic that we're focusing on today is managing the new learning environment as a result of COVID-19. While this has been truly challenging to us all, we are also contending with lots of other stressors related to the social and political climate in this country. Many of us are in stress overload. As the stressors mount and our ability to balance our responsibilities is further challenged, we could all use some concrete strategies to support our children and to maintain our own mental health. So today, I'll be sharing some strategies with you that I hope will benefit you and your family. For the sake of time, I'm going to try to go through these strategies quickly, but first I'd like to make a few important disclaimers about the content of the presentation. Number one, COVID-19 is still fairly new. So much of the content has not been empirically validated or extensively researched yet. These strategies are solely based on professional opinions of mental health practitioners like myself and other authorities. These strategies are not a one-size-fits-all. These strategies are fairly generalized, so they do not take into full account specific natures and needs of every family and every individual. So as you listen to the strategies today, you may decide to take some, you may decide to leave some, and in some cases, you might decide to modify some of these to fit the needs of your individual situation. So let's look at some of these strategies. I have 3 quick slides that I'd like to share with you. Feel free to screenshot them if you think it might be helpful to keep this information. And if you have questions, you can absolutely use the chat feature. So I'm going to try to share my screen now. A second. Maybe I hit it too soon. It's not coming up. 1 second.
Do you see it?
Nope.
Let's try
It doesn't
again.
seem like you've shared with me. It's not coming up.
Sent again.
Now it says I'm the co-host.
All righty.
Okay. I don't think this is it, but let's see what happens. No, it's sharing whiteboard. Can you see that?
Yes, ma'am. See a whiteboard.
Okay, well, let me see if I can just. Can you see my slide?
Not yet.
Yeah, it says I'm sharing, but it won't pull up this particular screen. Not sure why.
Dr. Crawford, does it say more screens below or something like that? Another option if you have a couple of windows open or something like that?
It does not. Let me close everything else off and see if I can try this again. Sorry. Okay, so I'm hitting my share screen and it just says advanced sharing options. It says one participant can share at a time.
Hold on 1 second. Go ahead now.
Yeah, it's still doing the same thing. I don't know why it's not allowing me to. Yeah, when I hit share screen, the only thing that comes up is whiteboard.
Not sure what's happening because you're the only co-host.
Yeah, I don't know why. It's not showing my slide.
All right. Did you send them to me or they're the same ones that you sent to me?
I didn't send them to you.
Okay.
I can send them to you real quick.
Okay. Thanks for everybody's patience today as we deal with
Yes.
difficulties.
I tried this earlier, it was working fine. I don't know why it's not working on this particular Zoom.
Okay. All right.
Yeah,
Get
I
that
tried
up.
it one more time just to see before I
Okay.
went through the trouble of emailing it to you.
Okay. All right, so I had put a note in, if folks would like the PowerPoint presentations, please email me and our panelists will be happy, I'm sure, to share. Please put your email, in the chat box privately to me. And I'm making note of them and then I can email the results up to you. All right.
Dr.
All
Pear,
right.
this will be coming to you from my Hotmail.
All right, I'm on the lookout.
Okay. Can you tell me your email address really quickly? I can't pull it up now.
Sure. KMEEART.
Oh, I'm sorry. You're going out, in and out.
It's in the chat box.
Oh, okay. Thank you.
No problem. If folks have questions too from what they've heard so far, you can put those in the chat so we can start our Q&A session in a few moments after other presenters are done, because I know sometimes you have a question and then you may lose your train of thought. So feel free to put those in the box. Thank you, Miss Kathy. I see your comment. Okay. All right. Library. Okay. All right. Haven't received your email just yet. So I'll wait until I get that. Are you, Dr. Crawford, okay if we go on to Dr. Park for her presentation?
Yes, I'm sending it to you now.
All right.
Sorry about that.
No probs. And I need to, Dr. Park, would you like to intro us for a moment?
Sure, no problem. And were you going to share the slide I sent with you, or do you want me to put it up?
I sure can in a moment.
Okay. So
That-
you want me to go ahead?
No, go ahead. Yep, you can please give us your intro for yourself.
So I'm Liz Park. I'm the director of Greenbelt Cares Youth and Family Services. I have been here at Greenbelt Cares for about 15 years as the director, and I'm going to be talking about the 5 youth service bureaus throughout the county. And we provide a variety of services to youth and families. We receive both state and county funding to provide these services. So we're able to provide them at very sliding scale or at lower cost than some places. District Heights, which I'll mention, is the only one that accepts insurance. So youth service bureaus are part of a state and local partnership to provide mental health services to individuals, children, and families. So here at Greenbelt Cares, we do family counseling and we do individual adult counseling. We offer parenting classes. We have anger management classes. When school was in session before COVID, we did groups in the schools, but we also do the alcohol and drug assessment referrals for youth from the school system. So if a child is at school and has an incident where they are caught either under the influence or have something on them, they have to go through an assessment, and we provide those also to assess and see if the child needs more services, or sometimes they need some family counseling, they need some tutoring help, or some other stressor in their life. So there's 5 youth service bureaus. There's one in Bowie, one in College Park, one in District Heights, the one here in Greenbelt, and then one in Laurel. We all provide family counseling services. Since COVID, we have all gone to providing teletherapy services. So we're all providing our services virtually currently. Laurel, I believe, will do in the office if somebody prefers that, but the rest of us are still providing via Zoom or Doxy or some other format. It is a challenge to provide teletherapy services sometimes, but it's also a real convenience because families don't have to leave their home, don't have to gather up all the children, leave work, then come to therapy, and then get back home again, maybe having had dinner or not. At Greenbelt Cares, we try and take away as many barriers to getting services as we can. So when we do offer our family counseling services here in the office, we offer babysitting services so that you don't have to worry if you're 18-year-old or your 15-year-old is one who really needs the help, but you have a 5-year-old and a 3-year-old, you can bring them with you and we'll help you out and not have to have you managing all of them while you're trying to help out your older child also. We all use evidence-based practices at our agencies, which means that we're using those models that have shown to be effective in providing family counseling. And we also know that the research shows that when a child is having problems, if you can support the whole family, there's much greater success. So while we often get calls and parents will be asking, can you just see my child? We always let them know we are going to see your child in the context of the family. because we know that parents, as we know, are also stressed by what's going on with that child, whether your child's having problems in school, your kids are fighting, they've run away, they have a drug abuse problem. You need that support as much as your child does. So that's why we always take the family approach. College Park, District Heights, and Bowie do offer some individualized child play therapy, but again, they're always looping that family in. Here at Greenbelt Cares, we offer what's called parent-child interactive therapy, which is for younger children. And this is specifically for kids about the age 3 to 7 who maybe have been put out of a preschool or are showing very aggressive behaviors at an early age. And this model has really been shown to help the family learn new styles of parenting, to learn effective ways to manage this child and get them back in school and get them back to where they need to be. Since COVID, I would say the main stressor we're seeing is how to manage your children being home all day with you while you're trying to work. And so in the family counseling that I'm doing, I'm often working with families around how to manage my job and then also help my child be up in time for their school, what lessons they have to get done. And then I'm also a mother of a child who's gone off to college this year and a new freshman in high school. So I can completely empathize with my clients of that struggle of working and then also trying to manage and help your child adjust to new situations, being virtual, and handle all those kinds of things. So you can see on the screen that we have all the information about the different youth service bureaus in the county. You can reach out to any of us. And we do serve Prince George's County at large. So even though I'm in Greenbelt, I can serve anyone from within the county. Obviously, when we're in person, people tend to, hub around where it's easier to get to. But now that we're virtual, you could live down in Cheltenham and still come to Greenbelt Cares to receive family counseling, and that's not a problem for us. So thank you, Carrie Ann, for including me on this presentation. I'm really glad to be here.
Thank you.
Or Dr. Peart, I should call you Dr. Peart.
I know, trust me, I'm still getting used to it too, either which way. All right, thank you, Dr. Park. Okay, we will have Dr. Shaw present next, and then we will move into some other discussions and wrapping up the other presentations. Dr. Shaw.
All right, and it looks like, do you guys see the slides?
Yep.
All right, do you see them in presentation view or?
Yes, I do see it in present, so I see your notes and everything.
Oh, okay. All right. Oh, and you don't see the presentation. I have two monitors up. Let's try this. Do you see in presentation view now without the notes?
Not yet. Switching over, now we do.
All right, okay, I'm gonna stop and reshare just.
Yeah, you just.
All right, there we go. I'm all good. All right, so I took away that second screen, but thank you, Dr. Peart, and thank you to Dr. Askey, the county executive, and Dr. Carter for having me here today for another presentation on behavioral health. We've done these on and off with Carrie Ann's keen coordination since May for mental health awareness. And just the fact that they're becoming sort of a regular request at the county executive's level, I think in itself is an indicator of how much our community has a need for this service. So thank you guys for coordinating and thanks for having me. So clearly this is an unprecedented time. We've had this global viral pandemic and this will likely lead to a future behavioral health crisis. We're already seeing it as we were just saying, but we also have had, there's been some forecasting of data saying that there would be like 100,000 deaths possibly due to suicides and overdoses based on the financial implications and the economic implications and of this, as well as the stressors related to the pandemic in itself. So only time will tell what this will look like for us in the future, but clearly this is going to be an unprecedented time. And as you guys know, there has been a disproportionate burden on Black and Latinx populations with this virus. So Prince George's County literally has had more cases than some states in our United States at some point. The response has been, a valiant response. And I don't say that just because I work in the health department, but people have been working tirelessly, and our data has indicated that we have done a lot of work. Still, the virus has run rampant, and primarily because we are a minority county. And the data is already starting to indicate from the CDC that this disproportionate effect with respect to the viral impact will also be a disproportionate effect with respect to the mental health, behavioral health effects. And when I say behavioral health, I mean mental health and substance use disorder combined. So I'm going to start us off a little bit with the interactive, but when you think about the pandemic, what's the first thing that comes to your mind? If you can throw it in the chat. Just what's the first thing that comes to your mind when you think about the pandemic? Make sure you guys are still awake. Thoughts or feelings? Fear, getting sick. Yeah. And I think that in general, this fear and the unprecedented illness that we're seeing is so impactful, not only just because we know it exists from the news, but because of its impact on on racial and ethnic minorities. I think more of us probably know people who've been directly affected by it, as opposed to this being some virus that you hear about on TV or you just have to wear a mask for. I think when you know of people getting sick from it, it makes you very worried and fearful. And then also, I think we would be remiss to say that this the current anti-racism social movement, the social justice movement, the fight against racial inequality that has resurfaced in our country, and the racism that is sort of, I think, was more covert, that's become more overt in our country as we see all of this is also stressful. I think that, I'll say apolitical, but just even for a lot of people, this election is also a scary time in our history. And so, I think that with all of this said, you had the pandemic, and then you had the race, this whole George Floyd, et cetera, going on, and it's really compounded the fear, and especially compounded the racial and ethnic fears. And there is the trauma regarding the police violence, and I've already sort of listed out, but there's a mix of emotions between anger, joy, fear, hope, ambivalence, just not sure what to do with it, shame, guilt, or complacency. I know for myself, when the protesting started and I was afraid of getting sick, and I said, I don't want to protest. I felt kind of ashamed that I wanted to stay home. And I had to remind myself that, I'm a young Black female physician working in a health department that's fighting COVID-19. I'm doing my part, and that's how I'm going to do my part. And I had to settle that in my own self because of just this mix of emotions that comes about. So when you think of the social justice movement, the racial justice movement, what do you think of? Just throw those in the chat as well. So why is this so difficult? What is making this so hard? So the behavioral health impacts of COVID-19 go against the grain of what we know about disaster psychiatry. So not only do we have an illness that can create fear, not only do we have then stressors related to the economic stressors, the shutdowns, so working at home, and the fears of job loss, the job losses, all of that. We have all of that, but then the key things that we know are that you want to maintain structure and maintain strong, healthy supports when people go through crises, to help them get healthy and stay healthy. And the virus disrupts the ability to do that. And so this is one of my key pearls, my key take home messages is that healthy parents are essential to healthy youth. So if you are stressed or you're feeling overwhelmed, and you're not taking care of you, then if you don't take care of you for you, then think about taking care of yourself for the one that you're taking care of, because the key tenets, and that's what parent-child interactional therapy is all about too, is it's that relationship between the two. Healthy parents are essential to healthy youth. So this is just an infographic from the CDC, from a study that was done in April, May, June. And this was comparing some basically the risks and the rates of depressive anxiety, other symptoms from late June to a year ago. I'll go into the data before, but even just from then, about 40% of US adults reported struggling with mental health or substance use during late June 2020. And I want to say that the other 60% probably were lying or probably were not, in tune with their symptoms and what they were feeling, because I think it hit us all in some way, in some stressor or not. A stressor of some way. Anxiety and depression, about a third. Trauma and stressor related symptoms, often related to the virus. Everyone that mentioned feelings there mentioned fear. Started or increased substance use, about 13%, and seriously committed suicide, about 11%. So we are actually finishing up Mental Suicide Awareness Month, and we'll talk a little bit about that suicide data in a slide. But when you think about that 40%, yes, there was that 40% according to that, but when you break it down by subgroups, then about 75% in the 18 to 24 age group had a behavioral health symptom. And, that's a group that has there's so many changes inherent to that age group and that time frame. And you think about the people going off to college and what this means. And that's just it was very stressful for that 18 to 24 age group. You can have young parents in that group too. Then you have about half in the 25 to 44 age group. So that's about 10% more than overall had some behavioral health symptom. And this study, for some reason, I think because schools really weren't in session, when the virus first hit, and it was June, but they didn't look at parents, which I don't quite understand why fully, if to stratify that later. But nonetheless, that's a key parenting age group too. And then 52% in Hispanic responders. So still about 10% more than overall, about 15% more, or 55% in essential workers, which we know we have a significant Hispanic population and Hispanic and essential workers in our community, and about 66 in unpaid caregivers of adults. So people who are caring for, say, an elderly or maybe somebody with a different ability, that 66% had some behavioral health symptoms. And they did note, because they didn't look just at parents, so they did note that about 40% of those caregivers also had children at home. So that could have been a big part also of why they were so stressed. That was the most stressful group, are those that are caregiving. So I think that we could probably extrapolate that parents, especially now that school is in session and we're hitting our new norm, are so affected. So comparing the year before to the year current, anxiety symptoms are about 3 times higher in 2020 than 2019. Depression symptoms about 4 times higher 2020 to 2019, and suicidal ideation about twice that of 2019. And when you look at the racial and ethnic disparities there, you had about 10% in the general population, 19% in Hispanics, and 15% in Blacks. And just a reminder that this is Suicide Prevention Month. This is also National Recovery Month. And locally, we have seen, and statewide, we've seen our drug and alcohol related overdoses increasing. And our Prince George's County crisis response calls have been increasing as well during this time. So we are already seeing the actual impact. So what's going on to help mitigate this? What is our response? The state, national, local activities, here are some. So our peer recovery specialists have been adapting to provide virtual supports. We've established a multi-agency overdose response team to expand our work. We are working to have a structured substance use disorder screening provide services at all hospitals. and so that everyone can get a standardized way of getting connected to care and understanding what their needs are. Just like Dr. Park said, telephonic, telehealth access has been opened up through the federal level, and the state and the county have adopted that. And at the local level, we have provided technical assistance, supports and trainings to our providers. There have been grants and donations for PPE to support providers that may need to still have in-person services, such as a residential program, or say a harm reduction program where they're interfacing with people on the street. Our schools have received a grant to provide additional for telehealth technology and the school-based telehealth supports. There was already a great telehealth, great school-based behavioral health movement prior to this, and that's just went virtual. And then our crisis team has went to a first responder model. So now, as much as they can physically go out with their team capacity, they have been going out to calls for whomever calls them, and they've been seeing an uptick in the calls and the number of actual physical dispatches that they've been going out on. We've been doing a lot of community education and promotion, just like these types of events, and we have submitted a grant just last Friday to be able to have mental health first aid train the trainer sessions, so that that evidence-based standardized model for community behavioral health education will be available to our residents through some trainers that we hope to have our employees get the grant to be able to get trained. And we've been rebranding our public service announcements, putting out PSAs around behavioral health with our COVID-19 social media and posts and things. We have some things in the works that we're really looking forward to. And then we work closely with our local hospitals to support the increased demand and better coordinate care. And there's a program that supports our federally qualified health centers, the Health Assures program, and with the use of the CARES Act money from the federal government, that behavioral health services will be able to be provided through that program. So if somebody, say, goes to a federally qualified health center, they're unable to meet the deductible for some reason, then they can, the Health Assures fills that gap and make sure that the person is able to get treated without fear of cost, as well as being able to ensure that our local businesses, our behavioral health providers through our federally qualified health centers are able to provide the services that people need. So if you need help, it's important to know that you're not alone. You can find ways to stay connected. No one should feel alone. If some symptoms are normal, fear, anxiety, like we just mentioned, is normal to some extent. That fear, anxiety has gotten us to be able to stay home and protect ourselves. But prolonged extreme symptoms are getting in the way of everyday life as it should be. That's safe. You know, I mean, you know what I mean? That those are signs that to get help. If people are having suicidal thoughts, turning to alcohol or drugs to cope, that's very concerning. And then those with pre-existing mental health conditions are at highest risk. And those people really do need to get help immediately. So if you are having a crisis where you feel like you're at imminent risk of harming yourself or a loved one is, then call 911 or go to the emergency room. The emergency rooms are still seeing people who need to be seen and who are in crisis. However, if you do feel that you can maybe be able to communicate with somebody and you're not quite at that level, you want to reach out to a crisis team or get connected into care quickly, you can call 211 and dial 1, or go to this site here. It says a state site, connects you to our public behavioral health providers, those that accept Medicaid, but many of them also accept insurance. And then also you can text MD Mind Health and or your zip code to 898-211. MD Mind Health, it's another state site. It can actually, or it's through the state crisis line. MD Mind Health will also send inspirational messages just to kind of help you keep your spirits up, even if you don't really want to get in treatment. and it will remind you that you can text your zip code there too. So coping is mental health PPE. I know that this is not about coping, but it's so important to be healthy. Get treatment at home. This is stressful, and this is normal to an extent. But your immune system also is impacted by stress. So it's important to get help. Be deliberate in maintaining your mental health. Give yourself a break and grace, and just in grace to get through this. I think it's just so important to remember that it's possible to be a full-time employee and a part-time teacher at the same time. You know, and be okay with doing your best and knowing that you're doing the best for yourself and your family. Healthy parents are essential to healthy youth, and seek help. Although 2020 has been a rough year, we have to remember that hope is not canceled. So thanks, Carrie Ann. That's probably longer than my 7 minutes.
Thank you, no problem. So it's 3:03. I had some questions that were sent to us, and I wanted to touch base on some of those. If folks can stay on, that's great, because I know we also wanted to see the closeout for Dr. Tazanu's presentation and Dr. Crawford's. So I wanted to wrap those up and then open the questions to you guys, because I think folks have questions, or we can have formal discussion. The panelists are with me until about 3:15, 3:30, I think is what they've allowed for, but I know everybody is busy. So I appreciate everybody's patience and still hanging on with us. Dr. Tazanu, do you want me to open what you sent me and then have me share for us to finish you out? And while she's answering me, let me do that. There we go. All right, so I'm gonna pull it up so everyone can see my screen.
Karen, can you hear me?
I can hear you now.
Can you hear me?
Yes, I can hear you.
Oh, okay.
Do you want to pick up from, was it here we are? Here is where we were?
I was just hoping there wasn't present. Let me close the door.
I can hear her smoothly this go around.
I left off, we were pre-COVID challenge phases, and just to, as a quick reminder, I'm seeking to represent children and families with developmental disabilities and comorbid emotional behavioral health concerns. So I believe what I was attempting to do was just create some awareness for what is actually happening in our community. The last thing I think that I touched upon was some of the challenges with our families and the need for just getting education about their child or youth's unique developmental or special needs diagnosis, accessing specialty and emotional behavioral health. So these are challenges we've had even before COVID. And then our jobs as care coordinators, really, having to coordinate the physical health needs of our children. That's typically with physicians and different, our children's emotional and behavioral health care concerns, which can be different. You know, that most children are accessing kind of your traditional behavioral health with traditional therapists, but in our population, many of our children need to access more specialized behavioral supports, such as ABA, and challenges with that. So when we look at post-COVID, I would just say that all of these things are now amplified for our families. And we also now have these new challenges. I think that those of us that serve in our depression for our caregivers has just really gone through the roof. Our families are feeling additional isolation in addition to the isolation that they prior to COVID. And what we're also seeing is kind of increased emotional behavioral challenges in our children. These include anxiety, just like our parents, myself included. We're seeing a lot of aggression in our population, depression, abrupt transitions. Our children don't necessarily tolerate transitions very well. And so all of those things have amplified, and our ability to support them has been decreased. Also, just increased caregiver responsibility. I think everyone has touched on that. Asked to be teachers. And it's one thing if you're teaching a child that may have a normal cognitive or typical cognitive development, but now we're being asked to teach children that may have significant special education needs and significant cognitive delays. And that's already, a difficult task. Many of our children don't and to actually access the virtual learning, so that and the special education supports that come with that. And so that again creates more stress. I think it kind of a cycle of parents feeling that they're trying and then failure with not being able to really support their children from that perspective. And then lastly, just a number of providers, both medical and behavioral health, really hasn't changed. And if anything, we've had longer and less access because of COVID. I know just within our organization, we have had, like everybody else, to make adjustments in terms of how we see children. Many of the things that we once did to now transition to this telehealth platform. So that means that we're seeing less. There's a lot more, sanitization and things that have to be done in between. And so lastly, I just want to kind of leave with these resources. I think it's something that, all parents, including the population that I serve, can benefit from. The World Health Organization has a wonderful line of resources on mental health. And they're not necessarily geared towards children with developmental differences, but they're geared towards all families. They're very simple, very practical suggestions for stress management. And then this is another thing I thought was really helpful. If we can just think of easy ways of trying to be mindful of our mental health, thinking about just supporting our relationships, so the relationships that we currently have. And then routines, establishing routines. Routines are critical for children with developmental differences, just being able to that, maybe like this. And it doesn't have to be a routine that's inflexible. You can give our children a lot of tools to be able to help create what that routine looks like. But it's a great way to be able to help diminish anxiety when a child can kind of have some prediction of what is going to happen. And then for all of us, just learning resilience, learning to be mindful of our emotions when we're feeling sad, when we're feeling anxious, when we're feeling depressed, to be able to put words to it. Or for our children that may not be able to have words, to be able to have those visual supports to help them identify those feelings, and then to think of alternatives or positive choices that they can make around that. Karen, I'm not sure if you got the last slide, which is slide 8. May not, but yeah, there we go. And so I just wanted to highlight some supports, at least who we work with very closely in terms of just supporting parents pre-COVID and now post-COVID. I really want to give a big shout out for the Prince George's County Public Schools, their Family Support Center, which is led by Dr. Beth Diate, who's an educator, but she's also a board certified behavior analyst. And so we've partnered together to provide just many webinars and workshops for parents around not just mental health, but just distance learning and other things related to that. The other thing, other organization or entity I'd like to shout out is the Special Education Citizens Advisory Council. So this is a great forum for parents of children with special needs who are in special education to be able to understand all of the different changes and ask questions about everything related to virtual learning and distance learning. And then lastly, our county school, as Dr. Shaw has mentioned earlier, I saw a type of their supports, has really been doing a lot to address mental health, and that mental health coordinator, mental health representative. He is the person to do that, but those are just a few things. But I do just think as much as possible virtually, because that really helps to decrease isolation and to build resilience. So thank you so much for having me, and thank you for putting.
No problem. Sorry for my interruption on my end. My housemate was trying to come in as like, don't do that, don't do that. sorry. My apologies. Thank you for recapping that and for closing out that session, because that was valuable information, particularly the school resource information. I don't think many people are familiar with that. So thank you for highlighting that piece for us as well. All right, I am going to do a quick shiftaroo and get Dr. Crawford's piece together. Today has been a testament to my tech skills.
Sorry for the technical problems, and thanks to
no, it's not you at all.
Yeah, thanks to the previous presenters. They passed the baton on and really did a nice introduction to the things that I'm going to be talking about. Which, going back to what I was saying before the technical difficulties, is I wanted to go over very specific and concrete strategies that you can use with your children and for yourself. So let's start with the children with slide 1. With your kids, closely monitor their social and emotional health. Do you see any changes in their mood or behavior? Is your child the same child you knew a few months ago? If they have changed, you may want to be curious about that, and you want to pay more attention to that. Along those same lines, keep the lines of communication open. Be sure that your child feels safe and comfortable talking to you. Try to avoid overreacting, criticizing, and yelling. These behaviors tend to make you less approachable to your child. This is not the time for our children to hold things in. We want to keep the lines of communication open and encourage them to talk as much as possible. One of the activities that I like using, and I encourage you to use at your home, is just employing some simple questions to everyone in the family, like a game. For example, at dinner, go around the table and ask each person to answer the simple question: what was your win for today at school? Or what was your win for today at work? What would you say was the best thing that happened to you this week at school or at work? Okay, and parents, you have to participate too, because we're often modeling for our children how to do these things. So you should answer the question as well, okay? What was your high of the week? If you had to pick a low for the week, what would you say it was? These types of questions tend to uncover information that kids may not volunteer, and they generate conversations that allow you to get a better sense of your child's emotional functioning. Do not assume that your older children are interacting with peers because of their social media use. The top platforms that our teenagers are using these days are Instagram and TikTok. These platforms don't promote social interaction as much as they promote likes. Your teen may not be feeling connected, and they may be more isolated than you really think they are. Just because you see them holding that phone all the time doesn't mean that they're connecting with people. Be sure to talk to your children, no matter how old they are. Also, many schools are reporting that the incidents of cyberbullying are on the rise again. Okay, even more reasons to check in with your kids, regardless of their age. All of our kids need our support right now. Secondly, encourage your kids to unplug, get out of the house, and turn the news off. Of course, we have to do that safely. Please wear a face mask and practice social distancing. Get away from those screens. Take a walk, play badminton in the backyard, ride a bike, cook outside on the grill, and the whole family sits outside and eats together. Discourage excessive isolation and try to do activities together that promote interaction. Get out the karaoke machine and Uno cards. Have some fun together. Next, exercise is good for the body and the mind. Encourage your children to dust off those basketball hoops, those soccer balls, and jump ropes, and join them if you can. They might be pleasantly surprised to see your skills. We have been talking about social and emotional needs, but let's also review a couple practical strategies. And I think in the previous presentation, we heard about routines and how important routines are. Establish routines for your kids. Going to school in person provided a lot of structure that kids needed, and they still need it now. Try to keep it going at home during distant learning. Instead of rolling out of bed 5 minutes before class begins, encourage your kids to get up early, get dressed, and have a good breakfast so they are awake, alert, and ready to learn. Everyone may not agree with this next idea, but I'm going to take a chance and say it anyway. I like the idea of having students turn on their cameras during live lessons for school. I know their parents have the option and are concerned about the privacy of their children, but I have a 7th grade boy, and I make him turn on his camera for all of his live lessons because when that camera is on, he is more accountable when his teacher can see him. And also in this year, 7th grade, he has a lot of new teachers. Okay. And seeing each other, even though it's through the screen, is helping to facilitate their relationship building until we can get back into the actual classroom. So I strongly encourage you to think about that. Think about having your children use their cameras during live lessons. And finally, make sure your child's school space is amenable to learning. They need a chair, a writing surface, and adequate lighting. Be sure that the area is quiet, free of clutter, and their school supplies are easy to access. This type of structure will help them be more focused and prepared for instruction. We can go to the next slide, Dr. Peart. The next slide is going to show strategies for parents and adults. And some of these will sound a little redundant because we did talk about some of these same strategies for your children. The first is to establish routines for yourself. Routines make life more predictable. You can be more proactive and less reactive. Routines can be very effective in mitigating stress. Second, you too need to unplug. Too much screen time and too much CNN is not good for adults either. Get out of the house. Again, do it safely, wearing a mask and practicing social distancing. Rake some leaves, take a walk, ride a bike. Get out and enjoy this crisp autumn air that we're enjoying. We could all use a change of scenery from time to time. Don't let those 4 walls close in on you. Third, get some exercise, whatever you like. Yoga, Zumba, everything you can think of, you can access online through a YouTube video, on demand. So you can't go to the gym? Well, get going in your bedroom or in the family room. Exercise produces endorphins that are good for you mentally, and we all know the physical benefits of exercising. Physical fitness is very important now because during this pandemic, let's face it, we've all been a lot more sedentary and we've been doing a lot more eating. Okay, we need to be careful about our intake and be sure to exercise regularly. Planning ahead. Be more deliberate about planning ahead. Plan for meals, for instance. Sundays are somewhat good days to cook a few meals, store them in the refrigerator or freezer for easy reheating and serving, and it will save you time after those long, stressful days of school and work combinations when you're frustrated and you have little energy for cooking. Plan for work. Consider adjusting your work schedule if you have the flexibility. Take advantage of flex time if your job offers it. If you can work earlier in the mornings, later in the evenings, or evening on Saturdays, you may feel less overwhelmed during the week with the demands of your child's schooling and your work during the day. Plan for me time. Be more deliberate about planning respites for yourself. Talk to your spouse, your friends, and family about watching the kids for a few hours to give you a break. This is especially true if you're a single parent or if you have really young kids. Parents need recess too. If you're sharing the responsibility of supporting your children with a partner, be more deliberate about outlining your plan. And once you have an agreement in place, folks, be accountable for your part so that one person doesn't get more burnt out than the other. Next, I want to talk about your own social support, keeping in mind that all human beings, including parents, want to be connected and feel like they belong. So stay connected. Plan creative get-togethers with friends and family on Zoom. Add funny themes, games, music, and make them fun. Or meet for outdoor activities for safe fun. Tennis, bike riding, kayaking, canoeing, horseback riding, apple picking, and hiking are all fun activities that can be done safely with masks and proper social distancing. Of course, some people have health conditions that make them more vulnerable to COVID-19. So definitely follow your doctor's advice and make decisions based on your own individual health status. Like your children, monitor your own mood and behavior. Have you changed over the past few months? Are you drinking more alcohol than before? It is important to take an honest inventory of ourselves and to take action if needed. A common oversight that many of us are making is feeling like we can only use brand new strategies for this brand new situation. This is not true, in my opinion. Do not assume that supports you relied upon for years are no longer valuable. They probably just need a little modification. If you have close friends who listened to you in the past, they can still listen to you now. It may not be over dinner at Copper Canyon, but you can still call them or Zoom with them. If you enjoyed going to church in the past, keep going. Go online and see what other online offerings your church has to offer during this time of crisis. Although COVID-19 has thrown us for a big loop, some of our old standbys still work with just a little tweaking. And lastly, and practically speaking, get out of bed and off the couch. Catch up on all those projects on your to-do list. I know all of you have a long to-do list or a bucket list, whatever you want to call it. And now you finally have time to try some of those air fryer recipes your coworker told you about months ago. You have time to start cleaning out that closet. I know I'm very guilty of that. You have time to start reorganizing the garage. And how about finally repainting that bathroom you've been talking about for a couple of years? Or learning how to play the piano finally. And what about reading those books you bought, never read? Or writing that book that you've been thinking about for years? Now you have the time to check some of those things off of your list. Being productive usually leaves us with a sense of accomplishment and a sense of pride. I say go for it. COVID-19 has brought new meaning to the phrase, there's no better time than the present. But even with all these great strategies, sometimes it's not enough to relieve all of your distress. If you or anyone in your family are still feeling anxious, depressed, or discouraged, you should seek professional help right away and don't delay. The last slide, please, Dr. Parrott. Please call member services for your insurance carrier or check the back of your insurance card for a behavioral health or mental health helpline. They will assist you in identifying a provider. As I stated earlier, I'm the CEO at Maryland Family Resource, and we're a local outpatient mental health clinic. We may be able to help you. We offer mental health services to children, adolescents, adults, and families. In terms of services, we begin by completing a comprehensive diagnostic assessment to get a sense of your presenting problem and your history. After the assessment, we recommend services that may benefit you. We provide individual, family, and group psychotherapy, amongst other behavioral health services and supports. Many mental health providers, like our agency, are concerned about the safety of consumers and mental health professionals during COVID-19. Therefore, many agencies are providing most services via telehealth until it's safe for us to meet again in person. You may also hear telehealth being referred to as telemedicine or telemental health. Telehealth involves the therapist or other mental health professional providing services via the internet. You will need access to a private space in your home, a laptop or desktop computer with a camera, speakers, and internet service in order to participate in telehealth. If you're interested in seeking mental health services with Maryland Family Resource, please call our main number today at 301-333-2980. This brings us to the end of my presentation, and I hope you found some of this information helpful. Thank you for listening, and I wish you all a safe and happy school year.
Awesome. So thank you, Dr. Crawford.
Well,
I appreciate so much everybody's information, everybody's preparation and time. And I have access to all these slides, and folks have already sent me their email addresses. So I'll be sending things out at the end of this. So now for this, if anybody has one or two questions that they'd like to have answered right off the bat, please feel free to ask questions now, or you can facilitate questions by sending me queries at the email address. So you can unmute yourself and go ahead and ask, or you can follow up in email.
Good evening, everyone. I am Jonathan Medlock, the current mayor of the city of District Heights. This was a great, great session. I learned so much information, and I actually have a lot of resources to go back to my city and my residents with in order to provide them with the help that's needed. There's so many great topics and points that were touched on. Great panelists, excellent job. Actually, some of the information was a little scary, just to hear the numbers that are being created by this COVID-19 event. But it was great information. I'll hopefully get the information sent to me in the slide so I could really reach back out to each of you to see where I can assist, or how you can assist me through the city. I know Dr. Park mentioned the Youth Services Bureau here in District Heights under Dr. Sargent. She's doing a fantastic job, and I thank all you guys for the work you've done. But excellent information. I was on the call from the beginning, and I couldn't get off because it was so much great information being shared, despite the hiccups with the computer systems. That happens, but you can't throw that out with the great information that was given. But thank you guys again very much for this particular platform, and I will be on the next one too, doing some great work. Actually, one really quick, I'm going to try to install next week a mental health component, behavioral health component on Bowie State's campus with the 100 Black men of Prince George's County. And that's going to be very beneficial for our over 6,000 students on Bowie State's campus. So I'm looking forward to doing that. But thank you guys so very much again, all right?
Thank you, Mayor. Thank you very much. Any other queries from anyone or comments before we close out? I really am so excited that folks stayed on with us. So thank you again for that. Okay, if anybody has any questions that come up, please email mentalhealth@co.pg.md.us. It's also in the chat box. So any other follow-ups you can send there. mentalhealth@co.pg.md.us. All right. So to my panelists, thank you all so much. I'm so excited that you all were able to present, and the information was better than we even planned. So that's also awesome to see content come alive after we've been discussing it for a few weeks. So thank you all so much for staying on with us, and we look forward to having you in our session next week when we have our federally qualified health centers presenting on the services that they've provided, some of the trends that they're seeing as well, and adaptations for better serving our students and our parents also. So thank you again, everybody, for joining, and we'll hope to see you next week. Have a good one.
Thanks, Dr. Pierce.